Great. Well, thanks very much, Sheila, for that introduction. Bonjour, bienvenue. Great to be here in Montreal. And I was considering doing my presentation in French, but then it would either be very, very short or it would probably take all day. So I stuck to English in the end. And the first thing I want to do before I start really is also congratulate the Infoway team, Sheila, Lynn, and all their co-workers and helpers. You know, I think to me, this seems like a great event, and I think they've really done an outstanding job, and hopefully the rest of the day will be on an equally high level as yesterday was. So congratulations to the Infoway team. So good morning, and during day one, I think there were some great presentations from a number of speakers, including Simon Kennedy, the Deputy Minister of Health. I mean, he said he didn't bring any cannabis with him, but he certainly told us some really interesting stuff about Health Canada and the way that organisation is adapting its regulatory format to kind of take into account new technology and the fast changes that you see within the field of technology. We also heard from Charles Alessi, representing HIMSS, and the very interesting points from Charles's talk, you know, the Athenaeum, of course, was a very interesting one as well. But, you know, the fact that only 10% of our health is impacted by biomedicine. That's a very small percentage when you look at it. But then, you know, I mean, about 30%, I think I'm right in saying, was genetics, and then 40% behavior. And so certainly engaging patients is going to be a very, very important thing to do. And then we had a number of other great presentations from patients, patient advocates. I also particularly enjoyed the digital storytelling from Mike Lang and the patient story that was shown as well. I think that was a really great way of communicating, something I'd certainly like to see more of. And so after hearing from all of them, I hope you feel engaged and energetic and enthusiastic about digital health. This conference, again, is being held during Digital Health Week in Canada, as Sheila remarked, and it's our annual celebration of all things digital health. Together, we've achieved a lot on behalf of Canadians, so we should celebrate the successes, but also there's a lot of challenges ahead. We'll need to face them head on, work together to overcome them. And today I want to talk to you a bit about how we can do that. I want to outline a vision for a new day in healthcare in Canada and show you the roadmap of how Infoway intends to help achieve it. A day when the fax machine will be gone, at last, acts of fax. All paper records will be replaced with electronic records. And a day when Canadians will have easy, convenient online access to their personal health information and also to be able to connect with digitally enabled health services. So in 2001, most of you, when Infoway embarked on its journey, most of you are likely familiar with the role that Infoway played in Canada's digital health journey. The organization was established in 2001, and there was basically at that time, there was very little digital health or e-health, very little infrastructure around. There was no agreement, for example, on the definition of what made an electronic health record. Most of the hospital systems that were installed at that particular time were used purely for admin purposes, not clinical purposes. Few, if any, primary care physicians had electronic systems, and if they were pretty simple systems as well. So there wasn't a common vision, strategy, architectural plan for digital health. And you may remember, some of you, the blueprint, the interoperable blueprint that Infoway published. And that was really the start, I think, of the national standards that were beginning to come out. Privacy and security approaches and practices also varied considerably across the country. So Infoway was given a mandate at that time to play a national leadership role in accelerating our collective efforts and ensuring there was a pan-Canadian vision, strategy, architecture, and plan, as well as national standards and common understandings about privacy and security. Over the years, the provinces and territories, as well as industry and other partners, have worked with us to advance the digital health agenda, and we're really grateful for everybody's support. The evolution over the years has, Infoway's role has evolved over the years. We started by working with our partners to invest and build the infrastructure for digital health, the lab, drug systems, diagnostic imaging repositories, and so on. A few years ago, Infoway switched our focus to providing the tools for clinicians to support greater efficiency and better patient care. Co-invested in tools like the electronic medical records, telehealth, telehome care, and so on. A lot has been done with those collective efforts, and since 2007, we estimate that $26 billion has been accrued in benefits to Canadians and the health system as a result of these co-investments. Now that the core systems are largely in place and connected, and the electronic tools are available for and being used by clinicians, we're focusing on driving access to care. And if you attended the partnership conference last year, you'll recall that I unveiled our driving access to care strategy at that time, focused on two key goals. The first one was achieving safer medication management through Prescribit, Canada's national not-for-profit e-prescribing service, and the other one was Access Health, a program to give Canadians and their providers online access to personal health information and digitally enabled services. This has been a significant shift for Infoway as we transitioned from being a strategic investor to being a service provider. So why is it important to drive access to care? The short answer is because Canadians deserve better access to care, and digital health can enable that. Digital health can also make our health system more efficient, eliminating paper and fax. It will improve safety and quality. It will make our system more sustainable for future generations. And if you were here last year, you may recall again that I showed a graphic about how Canada compares to peer countries with regard to access to health. It wasn't a pretty picture. The Commonwealth Fund's rankings of 11 countries placed Canada 9 out of 11, and last in several key indicator areas, such as the ability to review test results or email doctors. In surveys done by Infoway and others, Canadians have told us again and again that they want access to their personal health information online. They want to be able to view test results and email doctors. They want to be able to email their doctors with health concerns. They want to be able to see their lab results online, to book appointments, and they want to have virtual visits with doctors instead of taking time off and sitting in waiting rooms for routine purposes. They want their healthcare to be easy, convenient as every other aspect of their lives, like online shopping, banking, and travel and so on, everything you can do on your mobile phone and devices. We also know from surveys that better access empowers patients and makes them feel more engaged with their healthcare. Better access improves health outcomes. We heard about the impact of behavior on health. So the problem's easy to define. Canadians want access to personal health information and digitally enabled health services, and most Canadians don't have this access now. The solution to the problem is where the challenge comes in. So Infoway will continue to play a role in a leadership role as we tackle this challenge. And our strategy is based on the 4 principles that are displayed up here. Infoway has a proven history of facilitating the interaction of partners in the health system. We've also been building our expertise as a service provider with Prescribit. We've learned a lot over the last year about the challenges of rolling out a service in a country that has a fragmented health system. I believe Infoway is well positioned to apply these learnings to other initiatives, and we can deliver pan-Canadian solutions needed for 21st century healthcare, the modern healthcare that Canadians want and expect to have. No single jurisdiction or market player can solve this challenge on its own. And Infoway, certainly we can't do it alone either. So we're prepared to take on the leadership role, but we need all of you and all of our other stakeholders to be partners in this journey. I'm talking about a true collaborative effort where we all work together towards a common goal, giving Canadians better access to care. Infoway recognizes that everyone has a slightly different perspective, whether you're looking at things from a patient lens, a clinician lens, a jurisdiction lens, or the lens of a healthcare organization or industry partner. So, where do we go from here? Well, I'm pleased to announce that today we're going to be launching Access 2022, a movement to inspire a new day in healthcare. So what is Access 2022? Well, I've got a short video that I'm going to show in a second that will tell you all about it.
There's pride in our hearts for healthcare in Canada. For over 50 years, it's shown the world what equality and compassion can be. Now, we can show the world a new day in healthcare. Together, we're creating a movement to innovate Canada's health system, redefining where and how Canadians will access care. Access will be greater and easier, no matter where in our country you live. And it will be available to all Canadians. Introducing Access 2022, a bold vision for the future of Canadian healthcare.
Well, I hope you found that as inspirational as I did. And I really love the smile on that toddler's face at the end of the video there. So I hope you enjoyed it, found it an inspirational message. Access 2022 is a movement that's intended to build awareness, to inspire action amongst all of our stakeholders, and to help us achieve our collective vision of a new day in healthcare. Access 2022 promotes a future where all Canadians have online access to their health information and to digitally enabled health tools and services. This access will empower patients and improve health outcomes. This vision will move Canada's health system into the 21st century where it belongs, and it will restore our pride in our health system and Canada's standing as a world leader in healthcare. If the 22 in Access 2022 seems ambitious, that's intentional. This vision is aspirational, but there's also an urgency about it. We need to demonstrate significant progress. The status quo isn't an option, and taking our time isn't an option either. We need to disrupt the way we deliver healthcare in Canada, and we need to do it now. 2022 may be an aggressive target for some of you and for some of our stakeholders. For others, it's not soon enough. We won't necessarily meet all of our goals over the next 4 years, but if we don't set ambitious stretch targets, we'll never get the health system we want. So when I say the coalition of the willing, I mean everyone who wants to join us on this journey, and I hope that's going to be all of you. I've mentioned several times that we need to work towards the goal of giving Canadians online access to their personal health information. Canadians have had online access to their financial information, as you know, for years. So why shouldn't we have access to the same kind of information on personal health? There are some successful patient portals, for example, that are giving Canadians online access to their personal health information. Yesterday, we heard about Carnet Santé in Quebec. In Nova Scotia, there's My Health NS, an online portal. And in Saskatchewan, they're getting ready to roll out their Citizen Health Information Portal, CHIP. And that's going to go out to 130,000 people very soon. That portal will enable the citizens to view their lab test results, vaccinations, immunization history, prescriptions, medication history, and their history of hospital and acute care visits. The first regional portal in Ontario went live in August in the southwest, and that's an area that's populated by more than 3 million people, and this was an expansion of the Sunnybrook's MyChart personal health record. And we are also working with Mustamew Health Information Solutions and McKesson to roll out a community electronic medical record system and citizen health portal to more than 200 First Nations across the country. So together, we can expand solutions like these across Canada. So we can also work together to give Canadians access to more digitally enabled health services. We could leverage our learnings from Prescribed IT to work with partners on other services like virtual visits and e-mental health. Many of you have attended a session about Prescribed yesterday, or there's going to be more sessions today. We're proud of what we've been able to accomplish so far with that national e-prescribing service that enables community-based prescribers to electronically transmit a prescription to a patient's pharmacy of choice. The service is operating in several communities now in Ontario and Alberta, and we've got agreements in place with 9 jurisdictions in total, and I think we went live in a community in New Brunswick as well last week, so that's now 3 different provinces. And I think the impressive thing about this initiative, it's been a voluntary initiative. No province or territory is forced to join, but the majority have signed up, and we're confident and expect to sign up the rest of the country as well. In developing Prescribed, we made sure there was a smooth integration with EMRs and that the two-way messaging system was also integrated so the service could adhere to national standards. Canadians have told us they'd like to have virtual visits with their doctors. Virtual visits can be a win-win for everybody, saving patients a trip to the doctor's office, keeping people out of hospitals, and making care more efficient and less costly. There are a number of good examples, such as Kaiser Permanente, Mercy Virtual in the US. There's also a number of private companies offering virtual visits in Canada, but this is still happening on a limited scale. We've got an opportunity to really increase the pace and drive significant change. We're very excited about the partnership Infoway recently formed with Kids Help Phone. Last week, we jointly announced the national expansion of Crisis Text Line powered by Kids Help Phone. This is the first 24/7 free nationwide crisis texting service in Canada aimed at youth. It's available in English and in French, and it uses a leading-edge platform to alert crisis responders when someone is reaching out for help with a really serious issue. During the pilot phase, they estimated the service was saving 1 to 2 lives every day. So we need to have more enabled mental health services in Canada, like Crisis Text Line, like Beacon that we heard about yesterday, not just for young people, but for the broader population as well. Access 2022, one sec, my clicker's not working. There we are. Access 2022 is a joint effort between Canada's innovators in the public and private sectors, e-service providers, provinces, territories, healthcare professionals, patients and organizations. Together, we will develop and implement trusted solutions across the country. To bring together a coalition of the willing, we need to spread the word about Access 2022. As of today, we're embarking on a national campaign that's going to include the video that I showed earlier, a microsite, social media, broadcast, print, online articles, interviews, and ads. And awareness is a very essential element of a service like this if you're going out to engage the population. We did a soft launch in Ottawa over the last few weeks, and the response was really encouraging. There was a tremendous interest in Access 2022 through the interaction on the microsite, on Facebook, and on YouTube views of the video. A number of people have already joined the movement, and we hope you will too. So in the spirit of our partnership conference of these 2 days, we're looking for key strategic partners to join this movement and come along with us on this exciting journey. Joining the movement will give you an opportunity to help shape the future that we all want to achieve on behalf of Canadians. You'll hear more about this right after my talk in a concurrent session about the Access Alliance. So I encourage you to attend the session if you're interested in learning more. As we embark on this bold new vision of Access 2022, we wanted to ensure that Infoway was aligned as well. So about 6 months ago, we restructured our organization to make sure we had the right resources in place to lead this vision. We also decided to give our visual identity a makeover. We developed a brand strategy that is fresh, modern, dynamic, and you would have seen the red ribbon that ran through the video. This represents our lifeblood connecting all Canadians through digital health. We also developed a contemporary logo that's bold and vibrant with a stylized version of a Canadian icon, the maple leaf. You also see a highway that is subtly created within the negative space of the maple leaf. This intersection of the two represents driving into the heart of Canada, the connection between the past and the present, and the forward momentum of our organization. Our new visual identity is bold, simple, familiar, and unmistakably Canadian. We believe it will strengthen Infoway's reputation as a trusted leader in digital health in Canada. And to celebrate our new visual identity, we've got a gift for everybody who's here today. And really, with the weather outside, I think we need these things if you do venture outside the doors of the hotel. So, I hope you enjoy your talks, and I hope you'll help us spread the word about Infoway's new visual identity as well as Access 2022. The journey we're embarking on is an exciting one. There's room for everybody to participate. It will not be easy to achieve a modern 21st century healthcare system that's sustainable, efficient, provides better access to care and services, and most importantly, improves health outcomes. It will require a partnership, a concerted and sustained effort by all of us, patients, families, Infoway, governments, industry, and clinicians. Together, we can create a healthcare system that we all envision. A new day in healthcare is coming. Good morning, everybody. And I think we're going to be open now for some questions, I believe, for the next few minutes or so. And so that is my presentation. And now if you have any questions, I'll be happy to try and answer them. I'll probably remove my toque. So no questions, everybody's shy. Can you use the mic? There's a mic just in the middle. If you have a question, if you say your name, organization, and the question, that would be great.
Yes, good morning. Thank you for the presentation. My name is Brenda Sanderson. I work for Nanandaway-Wigamik, First Nations Health and Social Secretariat in Manitoba. So I've been here, this is my first time coming to this conference, and I was here yesterday, and there was one comment about First Nations, one question. And so I just want to know what Canada Health Infoway's take is on the status of healthcare for First Nations and the status of connectivity. We struggle with not only high rates of mortality and morbidity, and we've got a lot of challenges in our communities, and one of the biggest challenges is the connectivity. We are struggling to get access to healthcare. So one of the biggest opportunities is for us to use digital health. And beyond that, we don't have connectivity. When we are starting to deploy Panorama, which is now called FIMS, we only have 25 of our 63 communities that are able to access because of connectivity. So I just want to know what your opportunity is to service our First Nations.
Yeah, I think that's a great question and a really important issue for First Nations and other remote communities that are isolated and don't have the kind of connectivity. And obviously where that connectivity doesn't exist, then a digital service is very tough to provide. But I think there's also a big focus and pressure on the government to help try and provide these services on a broader basis, and we're certainly lobbying as much as we can to help with that effort. As I mentioned, several First Nations communities are going to be adopting the technology, and I think we really have to look at how we do extend the benefits to all Canadians, because in the end, not everybody has a cell phone either. And I think that we don't want to have less advantaged populations kind of be excluded from this type of strategy. I mean, some of the answers you could say, of course, is that, you know, if we can overall improve the efficiency of healthcare delivery through electronic means and so on, it should improve the availability of services, even to those people who don't have access to digital devices today. But certainly, you know, I don't have an answer where we don't have a service. That is a real problem. But I think it's up to all of us to put pressure on the governments to help provide equity of service delivery across the country. You know, we certainly will be working with Minister Philpott's department to see what we can do to help with First Nations healthcare delivery. Thank you.
Marlon O'Neid, Portal 724. Thank you for the vision and the leadership. I'm appreciative of every effort you and your organization are making. To me, a highway is a two-way street. Access 2022 and what I've seen is showing us that we will have access to the healthcare system through digital health. But as a two-way street, and I'm listening to Julie yesterday and Aidan, that the public, the patient, has information to send on that highway. Access 2022 to me looks like a outbound, making it available for the public. What is Access 2024? Access 2028 is going to take us the other side of the highway?
No, I think that absolutely access is a bi-directional vision. It's not just outbound, but it's also inbound as well. And I think the whole issue as well in terms of looking after, you know, the complete health of an individual is also to have the ability for people to include information that they may get from wearable devices and other sources onto the system, not just limit it to the institutional data that you're going to get from the health system. I think there's a lot more that can be done. And absolutely, we're not just thinking of having a portal so people can review results. It really has to be an interactive system. I mean, the key goal is to make sure that people can actually use digital tools and that clinicians can use those tools effectively to change the way that care is delivered and received on both ends.
Michael, I'm in the back. I have some questions on the webcast.
Okay,
I'm just going to read them out. The first one is, while I like the concept, I do wonder if online access is so beneficial, why we need a movement. Who needs to be encouraged? Patients to use, healthcare providers to adopt? Where is the disconnect?
I think the disconnect is in the reality of today, because if we didn't need a movement, we would have all digital health tools, you know, fully connected anyway. And I think we've seen that this just isn't going to happen without a concerted effort and focus. So, you know, I think really that, you know, to be successful in this area, we've got to have a specific focus. We know that there are some tough changes that have to be made. There are examples about how physicians, you know, adopt these systems with the current payment models. You know, we have barriers, for example, that could come up with interoperability, with privacy, security, and so on. How, you know, who owns the data? You know, I think that needs to be defined. I think many of us believe it should be the individual that owns that data. And then how can we break down some of the barriers to exchanging data and so on? So definitely a movement, I think, is really badly required. And when you look at some of the successful jurisdictions, Scandinavia and so on, those countries have really focused on the initiative. The demand in the end has got to come from the consumers. And I think if you look at the consumer world, businesses can come and go, can change so dynamically, driven by consumer demand. And I think when consumers get more use of these services and begin to demand them from the healthcare providers, then that's the way that we're going to see success achieved.
The next question. Progress with Prescribe It has been demonstrated with provincial engagements. What are the two main lessons with wins of Prescribe It so far that will guide and accelerate the access strategy in the next 6 months? I
think, to me, I'm really impressed by the uptake of this solution, because it's only a couple of years ago that we really went into Prescribe It. And at that time, we didn't know an awful lot about pharmacy, and we've certainly brought on a lot of expertise. Bobby and her team has grown. And also a lot of people ask questions, why is Infoway coming into this solution and so on. And I think we've really kind of corrected that view from a lot of the naysayers. And as I mentioned earlier in my talk, one of the things I think we can really be proud of is the fact that this is a voluntary system, but nearly all of the provinces have adopted it because they know it makes sense. You don't need to have 13 different systems to do the same thing when a prescription is written in the same way. And it's the same for healthcare. Every province or other health services, every province is responsible and territory for their own health system. But also, there's a lot of things that have to be duplicated when you have that type of environment. And I think this is the opportunity where we can learn from best practice, we can spread it, we can help the smaller provinces, but we can also help the larger provinces as well. So I think it's a solution that fits all sizes.
The next question is, what do you want me to do if I join the movement?
Wow. Promote digital health. So we want you to be a strong advocate. I think it depends on your role. If you're a clinician, then obviously we'd like to see you using digital services in your daily practice, and also being an advocate for the expansion of those services with colleagues. If you're an industry partner and have great solutions, we want you to join this initiative so we can help you spread those solutions across the country. If you're a patient, we want you to take access from these systems on your mobile device and also advocate with your healthcare professionals that you visit, for better health services. So I think there's an awful lot that everybody can do. And during the day, in the other sessions, we're going to be kind of talking more about how this movement will work, about the Access Alliance. But we're also looking for great ideas. We're looking to other organizations, other countries, and any of you, what great ideas do you have to help us make this a successful initiative?
Hi there, I'm Brian Fennoston, Mohawk College, Hamilton. So we've heard a lot of things. It's a movement, it's inspirational, it's aspirational, it has 2022. It's going to give patients access to their healthcare information. These are all exciting principles. I'm just a simple software builder, and I'm trying to figure out, practically speaking, and I'm not trying to be combative or facetious, what are we actually going to build? What sort of, are you suggesting that we're going to build a Canadian digital identity that every Canadian can use, or are we going to have to wait for each of the provinces to buy into this vision and join the movement? What sort of things can my colleagues and I actually build and do next year right away to move this forward?
Well, I think that with anything, we have to look at the kind of aspects of lean build, so that, we can't have a fully functional system on day one, or we may wait forever. And I think we use the same philosophy with our approach with Prescribe It. Basically, what we focused on was trying to get the prescription transmitted from the prescriber into the pharmacy system, and without all the bells and whistles and everything else, which are very important, but you're not going to have those on day one. And so already we see a number of access initiatives. I've mentioned like e-mental health, patient portals, e-consult, virtual visits, and so on. So there are a lot of those tools that you and your colleagues have developed software for. Those tools are all promoted. We will support those. We'll work with you in an alliance structure, which will be explained a little bit later in more detail, of how we will help you roll out those systems and also help organizations and individuals adopt those services. And so, we don't have to wait for the whole idea to be completely defined. When we look at the platform that we're talking about, there are common services like citizen identity. And will there be one identity approach for the whole country, or would we choose a selection? Maybe we don't want 100, but 1 may be too few, 3 may be the right kind of number. And again, I think we're looking at best practice. Different provinces have come different ways on this journey, and we're looking at the state-of-the-art solutions that exist and seeing how we can move through that field. So we don't have all the answers today, but I think we can come up with some really good common approaches, and then we can really promote what works well and help accelerate that across the field.
A couple questions on the webcast. How will you encourage and incentivize hospitals to implement these services on a system level? Love the concept, but wonder how this can be readily adopted given our existing care model.
I think hospitals that we've seen, I don't think it's going to take too much encouragement, and I don't think we need to give hospitals incentives. I think right-minded hospital leaders know how important digital care is going to be for their future sustainability. And, I think, again, we can promote some excellent practice. There are some great examples within many hospitals across Canada of digital health. And also, at this particular time, we see across the country, hospitals are investing hundreds of millions in new hospital information systems from Epic and Cerner and so on. And so there is a huge movement already within the hospital field to update their clinical systems. Once they put these clinical systems in place, they're going to really need to make sure they get a decent return on that investment. And the only way they can do that is to improve patient care, improve sustainability. Otherwise, why bother with such a huge program of investment? So I think we're seeing some very encouraging signs that the hospital systems in Canada now want to get up to that high level of automation, the MRAN 7 level, for example.
Next question. As you mentioned, we are behind many of our peer countries when it comes to access. How can we catch up, let alone be leaders in access?
I think that's the whole concept of this program, really, and that's one of the reasons we're behind. And when we looked at the prescribe it area as well, the fact we're behind is because each health system tried to solve the same problem over and over again. And even the bigger health systems like Quebec and Ontario don't have the economy of scale of a very large country. And so I think the key is to see how we can catalyze and really increase the efforts by having a concerted focus, working with people on the enablers, and really focusing on how we can get quick wins, but also proliferate the good stories across the country, across our system. And that's the whole idea and concept of Access 2022, is to identify, celebrate those successes, and focus on expanding them throughout the system.
And I think this is the last one. Is there a particular country or model that Canada could follow to improve access to care?
I think there's a number out there, and we've looked at a number of different systems. You know, Estonia is one in terms of a digital society, but some of these countries are pretty small. And so, you know, some of the larger countries, the UK has some examples of success. They've also had some challenges. So I think we have the good news that we can kind of learn from some of the mistakes that others have made and perhaps move forward a bit quicker in many respects. But I think Scandinavia, definitely a number of countries in the Scandinavian field, and like Holland as well. We know that Australia is in the middle of launching their national health record. They're also finding, you know, good and bad aspects of that implementation. I think we can learn a lot from many of the others. Within the US, a private fragmented type of system, there are some great examples of individual health systems like Kaiser Permanente, Cleveland Clinic and so on that have done some remarkable things with digital technology. So I think there are a lot of case studies out there that we can learn from and that we can aspire to those kind of levels of digital innovation.
My name is Francesca Disler from Commission d'Accès à l'Information. We compare the access with a highway. Then on the highway we have road sign. So where are the road sign? Because there's inappropriate access that are done to health data. In Quebec we have inquiry, notice, curiosity of the care providers for the patient that visit them that are popular, such as, I don't know, Céline Dion. When she goes to hospital, there are curiosity for our data. There's also people who use that to find their friend and visit them at the hospital, or share with a person who has a personal interest in those data. And I speak about those doctor, infirmière, etc., that use the data for inappropriate use. When they want to use data on paper, they have to go to see the archive, and they say no, but the system doesn't say no. So what we notice in the inquiry is people say, I didn't know that I could have access to data that a person who is not my patient. The system doesn't say no, so they think they could have access to that. So how do we plan to deal with that?
Yeah, certainly I think one of the most fundamental elements of any system is the security and the integrity and the fact that the information must be kept private, secure, and really only relevant people should be able to access relevant information. And that is, you know, a very important stream of the whole Access initiative. And, you know, we have a lot of resources in this area, and we'll be working with the provinces, with institutions to make sure the system has got that integrity built into it. It's something that we've been very mindful with our Prescribe It initiative. Again, you know, we can't even contemplate having an e-prescribing system breached. And so security is definitely top of mind in that area. You know, in the end, I know also if you look at some of the existing hospital systems, you know, for example, diagnostic imaging and so on, lab systems as well, they usually have systems in there where they can track who's accessed files. And so sometimes they may not be able to stop someone accessing, but they'll definitely find out if someone did inappropriately access some information. So I think there are a lot of different tools that can be used to improve the integrity of the system. And we know that's going to be a really key concern of every person, that their information is kept private, but also that they have the ability to share the information with those care providers and family members that they choose to share the information with. So we agree with you, privacy is definitely a top-level concern.
Hi, my name is Janica Hoskins, and I'm a patient partner, but my background also includes doing a lot of funding through Jordan's Principle, as well as working with the Central Urban Métis Federation Incorporated. So just coming from a perspective of the reality of First Nations we have status and then we have membership. So the reality is we might have, status for, let's say, 200 people, but our membership might look like 450 people. So, the cost and equity and the financing that's associated with being able to afford digital tools, is there going to be some sort of subsidy that's lobbied for that? Because I know you mentioned lobbying, which I'm really happy to hear, and I'm also being mindful of Métis communities, which, my grandma Rose went to Indian day school, and we don't classify to be eligible under the opportunities that Canada Infoway has working with First Nations because we have Métis status. So, looking at those two barriers to accessibility, what might be a commitment statement that Canada Infoway can use to lobby? Could 3-minute digital stories be helpful in conveying and illustrating the impact and the reality of our communities?
Yeah, I think that's a great point. And, we don't have all the answers for these questions, but I think the equity issue needs to be addressed. And what we would do is look forward to working with community leaders from First Nations and see how we can work with the groups to come up with the points that we want to promote with the government to put more resources into these fields. I think it's definitely an area where we really do need to focus strongly to make sure that the best impact can be achieved. You can see some examples as well globally in remote areas where technology is very much used to deliver healthcare. There's a number of examples now in Africa, for example, they're using drones to deliver drugs and also to deliver blood samples and so on. I think we need to be more kind of open-minded about how we can use technology tools in remote communities with First Nations, and it should be a great opportunity to improve care. I mean, if you could have virtual, a workstation with virtual consults with specialists based in remote locations, I think that would provide, some excellent additional support over and above what we have now. So we're committed to definitely listen to the arguments, to go to the First Nations Health Ministry, to do what we can to help innovation to help every community and extend this program, as I said, to everybody, all Canadians, all First Nations.
I do have a few more. We'll get to what we can. What exactly will Canada Health Infoway's role be in this movement? You mentioned Canada Health Infoway moving from a strategic investor to service provider. You also mentioned wanting to partner with industry, healthcare organizations, clinicians, patients, etc. What will Infoway's role be in these partnerships in ensuring real progress is made toward the vision you've laid out?
I think our role is really as a convener, as an organization that will enable services to be deployed, also have a direct role in the delivery of services. So we'll identify areas where we can make the best impact. I mean, as an example, we kicked off our initiative in Atlantic Canada a few months ago. And so what we've been doing with our partners in the Atlantic is really work with them to see what are the key areas that really interest them in terms of digital enablement. And we have a program for Prescribe It. We've been looking at the personal health information. We've been looking at e-mental health, which was a big issue for the Atlantic provinces. And now we're looking at how can we work together on a solution that's scalable, that would work well in the Atlantic, but also can be exported outside of the Atlantic. I think we don't want to come up with any unique tool that's a one-off. What we really want to do is look at how we can maximize that impact. So again, we're kind of really formulating what our role is going to be. I think certainly service provision is one of those roles, bringing together organizations, bringing investment into the programs, focusing on specific areas of need. I mean, there are so many different roles that we will be playing, and we'll play that role of coordinator, service provider, and innovator as a kind of, triple role, if you like, as we go forward with this initiative.
I think that's all we have time for. If people on the webcast have more questions, they can email us or tweet at us.
Great. Okay, well, Access 2022. Thank you.